So my next patient is Mr. Alberts, and he is 72 inches tall and he is 35 years old. So using our little handy chart here, his goal for the incentive spirometry is going to be 3,200 milliliters, and so I'm going to move this little yellow float to right about there. And this is going to be his goal. He probably won't hit it the first several times, but it's a good way to work up to that. And as long as he's slowly improving and eventually getting there, then that's good. So I have listened to Mr. Albert's breath sounds. I've taken his respiratory rate and his pulse, and everything is good there. And then I'm going to instruct Mr. Alberts. He's going to exhale completely and then put his mouth around this mouthpiece here and make a tight seal. And slowly inhale. And so this little yellow float here is going to rise. The harder you inhale, the higher it goes. You want to keep it here in between this best and kind of better area. So that's a nice, long, slow inhalation. And then at the same time, this white float down here is going to slowly rise. Again, he probably won't make it all the way up the first couple of times, but that's okay. So he's going to slowly inhale until he can't go anymore, and then hold for about 5 to 10 seconds. That breath hold is the most important part, and so we really want to make sure that they're doing that. It's usually about till that white float slowly goes back down to the bottom is a good way of kind of tracking it, because people forget to hold their count or hold their breath a lot. So it's just easy to be like, okay, once you hit as far as you can, just hold your breath until that goes all the way back down. And then I am going to keep checking in on Mr. Alberts and making sure that he's getting closer and closer to that goal and that his breath sounds are improving, so that we make sure that we're making progress to prevent that atelectasis post-op to an abdominal surgery.